let me go ahead and, okay, recording
Michael,
has started.
can I ask you a quick?
Yeah. Let me, okay.
Okay.
Recording is on.
Recording is on. Alrighty. Good evening, everyone. This is Matt Ramey, and it's nice to have all of you with us again tonight. This is the 8th meeting of the General Plan Advisory Committee. And because we have a very full agenda tonight, we are going to jump right in, albeit 10 minutes late because of technology issues, and just start right in on our evening. Tonight's presentation and discussion is going to be on health equity and environmental justice. These are clearly topics that have become part of the forefront of what's going on in the world today. And so they're very timely topics. Our agenda and objectives tonight for this meeting, after a brief introduction and welcome and instructions on how to use Zoom, we are going to have a guest presentation by Dr. Gregory Freeland of CLU, who's an expert on environmental justice. After that, I will follow up with a presentation on existing conditions information on health and environmental justice, and also background to bring everyone onto the same page about topics such as the social determinants of health, environmental justice, health in the built environment, equity and racism, and then a little bit on, again, on existing conditions. After that, we're going to have questions and then a discussion. Melissa, can I turn it over to you here?
Yes, thanks, Matt. So my name is Melissa Stark. I work with Matt at Ramey & Associates. I'm going to quickly walk us through some of the key features of Zoom for folks who maybe haven't used it or are using a lot of different platforms and can't keep everything straight. So next slide. So everyone's got their audio hooked up. Just to let you know, there's two options. You can use your device's audio, or you can use headphones like I am if you prefer. Just be mindful of background noise because we do have a large group here on our Zoom meeting.
And please mute if you are not speaking.
That's my next slide, yes. Once your audio is connected, just click that same button and that'll make sure you're muted. To unmute yourself, you can click that same button there. It's an option to have your video on. At some point, this meeting will be up on Facebook, and so it's completely up to you if you'd like to have your video on. You can turn it on by clicking this button here and turn it off again by clicking the same button. Just be mindful of any background or any folks that are in the background. If you have a question you'd like to ask in the middle of our presentation, you can use the raise hand feature. You do that by clicking the participants button here, which will bring up another tab that you see on the right-hand side here, and you can click the raise hand button. I think we're going to ask folks to stay muted for as long as you can. We'll have points during the presentation for folks to answer questions. Please remain muted until a member of the team calls on you. And then for folks who are attending, members of the public, and eventually on Facebook, thank you for joining us. We're happy that you're here. We're encouraging you to follow along and provide feedback. There's actually a comment forum that we have for folks who are watching to send in questions or ask comments. A link to that is on the project website, which is listed there, toaks2045.org. This will be open longer than we have listed here since this meeting will be recorded. If you have something you'd like to submit after that and the poll has closed, feel free to email the team, gp@toaks.org. And then just a note for folks that are on the line with us right now, we will have an opportunity to call on you. We're going to wait till a little bit later in the meeting. We're going to try to get through a lot of content. So if you wouldn't mind holding tight, we will get to you, and we appreciate you being here.
Thank you. I would like to now, we're going to actually have a special guest speaker tonight, Dr. Gregory Freeland from California Lutheran University. As I mentioned, Dr. Freeland is a professor of political science. He is the director of the Global Studies Program and a faculty advisor to the Model United Nations. We asked Dr. Freeland to talk tonight and sort of help set the stage for the conversation. He is an expert on environmental justice, and we really want him to really appreciate him coming tonight, and we really appreciate his perspective. So I'm going to take my screen sharing off, and then Dr. Freeland, are you there?
Yes, I am.
Okay.
Muted. Yes. All right. Thank you for that introduction. So, are we ready? Should I begin?
Yeah. Please help set the stage for our conversation this evening.
Yes. I want to do just a brief introduction to the definition of environmental justice, as well as a little bit of a background and so on. But I read the material that you have already. It's very, very good, especially the general plan material. It's excellent. I will begin. We just lost a great individual, a Congressman John Lewis. And I have a quote from him to sort of set the stage for my presentation tonight. And feel free to, ask questions whenever you like. It was a courageous and brilliant idea to bring people together in a new way of thinking. Cooperative land ownership, not just an individual, but a community. Term environmental justice came about basically pretty much in the 1980s. Many of us are already familiar with the environmental movement, going back to the 60s and so on. Environmental sustainability and, saving old forests, et cetera, and so on. And I give this definition of environmental justice because a lot of times it's sort of mixed with the environmental and racism. They're two different things, really, but they're also relative in certain ways. So environmental justice can be defined in numerous ways, but a general definition would be that environmental justice is, quote, fair treatment of people of all races, income, and cultures with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies, and their meaningful involvement in the decision-making processes of the government. Based on this definition, environmental justice is achieved when everyone, regardless of race, culture, or income, enjoys the same degree of protection from environmental and health hazards and equal access to the decision-making process to have a healthy environment in which to live, learn, and work. If this environmental justice is practiced, then there is assurance that land use plans, policies, and actions do not disproportionately affect low-income and minority communities. With that in mind, a little bit of background to the general environmental justice movement as it takes place on an international and national level that sort of flows down to the regional and the local. During the 1970s and the early 1980s, many low-income communities and communities of color across the country, including Latinos, African Americans, Asian Americans, and Native Americans, concluded that unequal social, economic, and political power relationships made them more vulnerable to health and environmental threats than society at large. After early efforts in Texas and North Carolina, two examples which I give you, race, culture, and income continue to play a significant role in decisions concerning the location of polluting facilities such as landfills and toxic dumps. Numerous studies consistently point out that minorities and low-income communities are disproportionately exposed to environmental harms and risks. Now, I read the Thousand Oaks report, and according to the report, it does not have areas that are identified as what we consider disadvantaged communities. However, the disadvantaged community analysis found that there are census tracts in the cities with an average household income in the lowest 20% of census tracts in the state. So due to the presence of lower income census tracts, and I mentioned that this is also a prep for the 2020 census, which is should be ready in a year or so. So we'll see what that has to say. But Thousand Oaks is subject to a California Environmental Justice Element requirement, as you all know. So this focus on environmental justice can be traced to the environmental justice cases in 1979 in Texas, and another one in 1982 in North Carolina. In 1979, residents of Northwood Manor in Easton alleged that the decision to place a garbage dump in the neighborhood was racially motivated in violation of their civil rights under the Civil Rights Act. The District Court in Dean versus Southwestern Waste Management Company found that the placement of the dump would imperably harm the community. The court specifically found that the landfill would, quote, affect the entire nature of the community, its land values, its tax base, its aesthetics, the health and safety of its inhabitants, and the operation, of course, of the local high school, Smiley High School, located 1,700 feet from the site. The initial environmental justice breakout, which most people are certainly familiar with, sprang out from Warren County, North Carolina protests. In 1982, a small, predominantly African-American community was designated to host a hazardous waste landfill. The landfill would accept PCB contaminated soil that resulted from illegal dumping of toxic waste along roadways. The people in Warren County ultimately lost the battle. And, but their story, one of ordinary people driven to desperate measures to protect their homes from toxic salt, drew national attention and fired the imagination of people across the country who lived through similar injustice. So the street protests and legal challenges mounted by the people of Warren County to fight the landfill are considered by many to be the first major milestone in the national movement for environmental justice. Cities are often at the center of these land use conflicts that pit low-income communities, communities of color, against polluting industries and the agencies that permit. The environmental justice movement in the United States that generated national media attention in the 80s was due to this type of locational conflict. And residents fought the building of a hazardous waste dump in their communities on the grounds of environmental racism. One other important occurrence in 1987, Commission for Racial Justice, United Church of Christ, published an influential national study, Toxic Waste and Race in the United States, which identified race as the single most important factor in determining where toxic waste facilities were built in the United States. These distribution conflicts give rise to an uneven distribution of environmental burdens and perpetuate environmental injustice broadly. So more than 30 years after the study, there is still a documented and persistent pattern of disproportionate distribution of hazards and unwanted land uses of communities of color and low-income communities. Environmental hazards can be posed by proximity and exposure to hazardous waste facilities, bulk material handling facilities, warehouses served by diesel trucks, fossil fuel storage, transportation, various other industrial facilities that pollute the air, water, and land. Other commonly cited problems that environmental justice communities combat include dust, odor, noise, and light pollution, illegal dumping, toxic runoff into neighborhoods and nearby water bodies. These environmental burdens are not only disproportionately concentrated in communities of color and low-income communities, but evidence suggests that these same communities are overwhelmingly more susceptible and vulnerable to ill effects from this exposure due to a variety of socio-demographic factors. For example, such communities may have a larger child and senior populations compared to other areas. Younger children experience greater personal exposure than adults, despite the same level of pollution. Seniors can be more vulnerable to environmental exposure due to pre-existing heart, lung, and other health conditions. Low-income communities and communities of color also may be more likely to have been burdened by other environmental exposures in the past and experience higher rates of psychosocial stress than other communities. In addition, such communities tend to have relatively low rates of health insurance. All of these factors can contribute to the falling some hard times on certain communities. The effect of multiple pollutants from multiple sources combined with these underlying social demographic vulnerabilities in overburdened communities result in what is termed cumulative impacts. Cumulative impacts. Cumulative impacts is a framework for thinking about and assessing the vulnerability of communities, taking into account both environmental and socio-demographic factors. The California Environmental Protection Agency defines cumulative impacts as exposures to the public health or environmental effects of the combined emissions and discharges in a geographic area, including environmental pollution from all sources, whether single or multimedia, routinely, accidentally, or otherwise released. Impacts taken into account sensitive populations and social factors were applicable. and to the extent data are available. So that's it. As a result of sustained efforts from environmental justice activists, public health experts across the United States, EPA and Cal EPA, they created the tools to describe these cumulative impacts. Now, just a little quick discussion here about environmental justice, zoning, and planning. Zoning practices and decisions that on their face are race neutral. Routine that allow communities of color and poor communities to be zoned, for example, industrial, and significantly contribute to disproportionate placement of hazardous and toxic industries in these neighborhoods. Zoning and planning contribute to inequitable development, and this has important implications for the design of neighborhoods, health, and health disparities. Historically speaking, zoning originally came about to stem the spread of unhealthy viruses and disease in New York City around 1916. After progress was made to control the spread of infectious diseases through advances in environmental health, engineering, public health, and so on, urban planning diverged in mission and perspective. The plan of cities and zoning ordinance focused more on aesthetics, economics, and the property rights of the privileged, and less on public health. It's been established that areas zoned industrial have greater environmental burdens and health risks than areas zoned for residential use. Therefore, zoning practices allow a heavy industry in minority and low-income communities that contribute to the overall decline of these communities. As the presence of industry increases, property values decrease, community members are slowly displaced, and these areas are becoming increasingly undesirable. I want to mention one other report. A July 2003 report by the National Academy of Public Administration addressing community concerns, how environmental justice relates to land use, planning, and zoning. And they refer to the work of Juliana Mante in her article, Zoning Law, Health, and Environmental Justice. What's the connection? They reported that the historical and current local land use and zoning policies are, quote, a root enabling cause of disproportionate burdens and environmental injustice. So despite the demonstrated health risks, locating waste and toxic facilities in minority and low-income neighborhoods is viewed by some as a welcome means of providing these communities economic opportunities. However, a wealth of environmental justice literature has demonstrated that many low-income populations of color live in neighborhoods that are differentially burdened by noxious land uses, such as landfills, hazardous waste sites, incinerators, public-owned treatment works, sewer treatment plants, toxic waste inventory facilities, energy duct facilities, petrochemical plants, heavily trafficked roadways due to discriminatory and exclusionary zoning. So EJ literature has also recognized the lack of access to parks, green space, recreational facilities, pedestrian-friendly residential environments, and a disproportionate burden of pathogenic infrastructure such as fast food restaurants, liquor stores, cash checking facilities as environmental justice issues as well. These studies reveal that the disproportionate burden of noxious land uses and this pathogenic infrastructure leads to unhealthy physical environments, increased health risks, negative health behavior, disparities in disease such as asthma, cancers, obesity, diabetes, and cardiovascular disease in urban environments. Exposure to these noxious conditions have been linked to escalation of asthma-related morbidity, premature adult mortality, psychological stress, higher body burdens of toxic chemicals like lead. For example, the nation's obesity epidemic may be the result of the lack of neighborhood and city level infrastructure that supports physical activity, active lifestyles, and equity in healthy food access. Now, since the residents living in the Thousand Oaks Westlake area have the highest life expectancy across Ventura County, the report is that Thousand Oaks residents generally live very healthy lives. But the lack of healthy and equitable planning and zoning in poor communities leads to their different exposure to neighborhood stressors and unhealthy land uses and limited access to resources like medical facilities, grocery stores, parks, open space, and healthy schools. Living in or exposure to these poorly zoned communities lead to low-income population north being the most vulnerable to the effects of environmental hazards. So in conclusion, I'd just like to say that presently, there appears to be a serious recognition of environmental justice as a helpful solution to environmental problems. There is a revitalization of city planning with the potential to benefit all citizens, regardless of color or class, by improving living environmental conditions and providing new housing, education, and job opportunities. For example, city plans are viewing frameworks that focus on developing livable spaces where people can work, play, and shop without depending on automobiles. So to achieve social equity and environmental justice, we must have greater public involvement in overall considerations for the environmental health of the total community and fair allocation of resources. Jurisdictions have already implemented a wide variety of goals, a wide range of goals, policy, objectives, and actions that promote social equity and environmental justice, such as zoning in a way that avoids incompatible land uses, developing affordable housing for the residences, and incorporating accessibility guidelines into the building codes. And I just understand Thousand Oaks is heading in that direction. Thank you very much. That's it.
Thank you, Dr. Freeland. That was an amazing overview of environmental justice nationally and the causes of it and some of the impacts. We really appreciate that. We're gonna move into a little bit of background and existing conditions. And then Dr. Freeland is gonna be on, and please, he is quite an expert on this topic. So just very broadly on environmental justice. So if you have questions for him and questions for how environmental justice is can potentially or plays out in and around Thousand Oaks, please get those questions ready because he's gonna help us facilitate the conversation this evening. I'm going to share my screen here again, and then we're going to move on with the presentation. I want to start after that overview, and in fact, you covered a lot of what I was going to cover, so I'm going to move through some of these topics pretty quickly so we can get to our really important discussion tonight. But I want to start with the social context that we're living in now, and start with a real acknowledgement that between the protests that are going on over police brutality, as well as the impacts of COVID, we're seeing a sort of greater recognition of the injustices that are occurring overall throughout the United States. And it's a very challenging topic to talk about. It's very emotional for a lot of people. There's varying levels of knowledge about what racism is and what equity means. And so what we want to do is really kind of bring everyone onto the same page with these conversations and think about how we can incorporate these concepts into the general plan, which, as you all know, is the city's constitution and guiding document. So, we know that in recent months, there have been lots and lots of demonstrations against police violence. These photos are actually from Thousand Oaks. The most recent was the killing of George Floyd. However, clearly he was only the latest in a long string of deaths that have occurred at the hands of police overall across the country. And again, I'm not pointing out Thousand Oaks here. I'm just saying that this is what's been happening all across the country. These images here are actually from demonstrations that were going on in Thousand Oaks. So this is very relevant for the city. Concurrent with that, we have COVID, and I know everyone has been impacted by this, and everyone has been severely impacted by COVID. Unfortunately, when we have something like a pandemic, it actually disproportionately impacts certain segments of the population. In particular, these are numbers from California for COVID deaths by race and ethnicity. And what we can see, the green is the percentage of deaths and the blue is the percentage of the population. And what we can see is that African Americans and Latinos are disproportionately impacted by COVID deaths, as well as as well as those who are infected by COVID. So there's an equity issue that we have going on here. In addition, because of COVID, we have this incredible economic crisis that's going on and extremely high unemployment rates in such a short period of time. And the unemployment has hit Latino, Black, and Asian populations a lot harder than it's hit the white populations. The national average, you can see here in the vertical dotted line, and that Latinos, Blacks, and Asians are all higher than the national average in terms of unemployment. And so there's an economic impact. And then when you have a health impact and an economic impact, this is what Dr. Freeland was talking about when we start thinking about what are the cumulative impacts that are going on here and that can impact people's health. So I want to sort of kind of take a little bit of a shift here, because what is going on with a lot of this is racism, and it's not necessarily the racism of individuals, which is what we commonly think about. And so I want us to be on the same page here about these different types of racism. There are generally two types of racism that really impact a general plan and planning, and those are institutional racism and structural racism. When we say institutional racism, we're really talking about the discriminatory treatment, unfair policies, and inequitable opportunities and impacts based on race that are produced and maintained by institutions. When we say structural racism, what we mean is a system of institutions. So institutions working together that interact with one another to generate and reinforce these inequities. It essentially normalizes and reinforces the existing dynamics that advantage white people while producing cumulative and chronic adverse outcomes for people of color. So I know it's a little bit challenging to think about some of this, but if you all remember when we had the Happy City presentation by Charles Montgomery, as he talked about zoning and the racism that occurs with zoning and redlining. And those are actually examples of institutional racism that have happened over the years. And then we think about this question of what is equity. And I want to differentiate here between equity and equality. So equity is equality is when everyone gets the same amount. So for example, everyone gets a bonus of $100. That is equality. So everyone gets the same amount, but because people are starting at different levels, they're still, as you can see in the image here, they're still, people are still at different levels here ultimately. And what we really want is equality, where everyone ultimately ends up at exactly the same place. So everyone has what they need for everybody to be equal. And that's really what we're trying to achieve here with the general plan overall. And what we try to do in planning is we try to get to equality, or trying to get to equity. And you can't have equality unless you have equity. Then there's a term called the social determinants of health. And this is a sort of a busy slide, but I want to go back a little bit to what Dr. Freeland said, which is planning and zoning really started by addressing the health from land uses. And it was dealing with essentially disease and injury. And that's what we call the downstream effects of these land use decisions. And that's what you see sort of on the right. But over time, we've all learned that there's other things, upstream decisions that are made that lead to the downstream impacts. And so the public health field for a very long time was really dealing with these downstream issues. They were dealing with the chronic diseases and communicable diseases. But what we've realized is that in order to solve those diseases, we actually have to look upstream. We have to be like a salmon swimming upstream and actually deal with some of these really challenging issues, such as the social inequities, the institutional inequities, and the living conditions that some people are in. And what we do know overall, and as Dr. Freeland so wonderfully pointed out, and eloquently pointed out, there are disparities nationally according to race, ethnicity, and income that are disproportionately impacting low-income and people of color. And that's really this concept of environmental justice that we're trying to get at. And really broadly, what we're really thinking and talking about and what we're trying to get to is healthy and equitable communities. And there are all of these factors that go into healthy and equitable communities. It's not just it's not just income, but that matters. It's economic and job opportunities. It's where you live. It's whether you have access to healthcare, whether you have access to parks, whether your neighborhood is walkable, whether you live in an area where there's pollution and toxics. And all of these factors, again, are these cumulative factors that add up to how healthy some people are compared to others. And what we're trying to do, again, is to get to equity, to make it so that everybody is healthy and everyone can live in a healthy and equitable community. And so what we're going to do, and I'm going to give some background information, but then what we're going to do tonight is we're going to think about together, what does it mean for Thousand Oaks to be a healthy and equitable community? And what can we put into the general plan so that that the community is more healthy and equitable than it is today? And every community, regardless of how well they're doing, and Thousand Oaks is doing really well overall, but every community has the ability to do better. And so I want us to sort of encourage us to think through that. And so let's go through to the existing conditions overview. I'm sure you all have lots of questions already and lots of thoughts. Please hold them for a minute. And we're going to go through the presentation. Hopefully you all had a chance to look at it just for a couple of minutes when it was sent out this morning. So we want to start with race and equity here, or sorry, race and ethnicity. And this chart shows that Thousand Oaks is generally has a larger white population compared to Ventura County and a smaller Hispanic Latino population. The Asian population and Black population are actually pretty similar. And what we can see here with the colors on the map is that the blue and the darker green are areas where in the census block groups between 25 and 50% or 50 to 75% of the population is Hispanic, which is the largest percentage. So what we see is that there's concentrations of areas where there is a larger percentage of Hispanic populations. Another term that we have here, with social determinants of health, another indicator is the percent of the population without a high school degree. And education is very strongly correlated with health outcomes because it provides people, if you have the higher the education, the better access you have to a well-paying job, the better access you have to healthcare, to a quality place to live, to healthy foods, so to access to parks. And so what we see again is that there are census tracts in the city where the 25 to 30% of the population, of the adult population, does not have a high school degree. There's a small area where it's 30 to 62%. I don't know what's going on with that one area, but there are these pockets where there's a large percentage without a high school degree. Now, overall, Thousand Oaks is doing much better than the county and the state as a whole. However, there are these geographic areas, and part of what we're going to be doing is looking at what those geographic areas are. We also know that income is a strong social determinant of health outcomes, and it's even stronger than educational attainment. As with high school and education, it is linked to where you can live, whether you have access to healthcare, whether you have access to healthy foods. And what we see here is that in the city, there are disparities along racial and ethnic lines about the income of the median household income of a household. The median is just over 105,000. And what we can see here is that Black, African American, and Hispanic Latino are below the average. And then Asian and white. White is actually right at the average, and Asian and American Indian and Alaskan Native are well above the line. So what we see is, again, disparities in income across the city. This is a map of where that is. And so again, we're starting to see some of the same geographic areas that are have a higher percentage of Latinos and a lower educational attainment level, and also have lower median household incomes. And then we look at poverty. Overall, interestingly, the city does not vary very much across racial and ethnic lines, not as much as you can see Ventura County here, but there are still pockets where you have large percentage, 15 to 20% of the population that, or higher, that is considered living in poverty. So again, these are areas as social determinants of health that we want to look at. Switching over to health outcomes, overall, the city is actually doing really well. But compared to the state average is 80.9. This information here shows the county, and so the county itself is doing, overall really well compared to the state. But there are disparities along racial and ethnic lines here, although not as extreme as what we've seen in other jurisdictions. Looking at health outcomes, we have asthma, and this is asthma emergency room visits per 10,000 people. The city is doing well compared to the state. The state average is 47.61. The county is 13, so the county is really low. So there's a bunch of areas here in the city that have higher rates, higher rates than the county, but lower than the state. Diabetes is another health impact that we see, and overall the city is doing much better than the state or essentially the county as well. We have the majority of the area is less than 9%, less than 9 people per 10,000 who have diabetes. So again, the city's doing really well in this indicator. Dr. Freeland mentioned the environmental justice element and environmental justice in the general plan, and that's really our hook to be able to deal with these issues in the general plan. In 2016, the state signed what's called SB 1000, which required every jurisdiction that has a, quote, identified disadvantaged community to prepare an environmental justice element or to address topics of environmental justice throughout the general plan. There's a 3-step process. The first is the identification of disadvantaged communities. The second is engagement with members of those disadvantaged communities. And then the third is the integration of goals, policies, and programs to address the disadvantaged community priorities. The topics that are addressed and identified in state law are pollution exposure, public facilities such as parks and schools, safe and sanitary homes, which also includes the cost of housing, physical activity, so walkable communities and transportation safety, and then any other identified health risks or burdens, which include things like food access and community engagement. So we went through the process, and actually the state about 3 weeks ago finally came out with their revised guidance for how we do a screening for disadvantaged communities, and actually that revised screening has changed the city's status for disadvantaged communities. So the first method that you do is there's a state tool called CalEnviroScreen, which essentially looks at the broad, it's an indices of a combination of income and race ethnicity combined with environmental pollution, and you get a score. And if you're in the 25 worst percent in the state, you're considered a disadvantaged community. And the city does not have any of those. The second method is to take low-income areas, which are 80% of the state or the county median income, and we do this by block group, and then look individually at sources of pollution burden in the city, and that when you blend the two of those together, you end up with disadvantaged communities. So then you take method 1 and method 2, put it together, and you identify what your disadvantaged communities are in the city. And what we found when we did that analysis is that these areas in red here are identified disadvantaged communities. They are not disadvantaged communities according to the Cal Enviroscreen Screen tool. They are actually disadvantaged communities when we look at a combination of lower income areas, again, 80% of the state or county median income. And then they have one or more health risks, and there's 13 health risks identified as part of Cal Enviroscreen Screen. You go through each of those individually. And what we found is that these areas are impacted because of one of a combination of traffic burden, groundwater threats, the presence of hazardous waste, impaired water bodies, or overall pollution burden. And so the answer to this is yes, the city does actually need to deal and include an environmental justice element or environmental justice goals and policies throughout the plan. So looking at some diving detail in just a couple of these, one is housing cost burden. And we know that the city and the whole region is very impacted by housing costs. And here there's a method that's done for Cal Enviroscreen Screen about what is the burden. And what you see here is that you have some census tracts that are in the top 25 worst, 75 to 100th percentile of housing cost burden. Food access in some areas is also low. Interestingly, the food access actually is a little bit flipped here according to the lower income and minority populations, which tend to occur along, generally along Thousand Oaks Boulevard and the 101 freeway. That's where the retail is, and so that's why there's access. But it's really areas outside of this that actually where there is no or limited access. And that's just because of the low density pattern of the community. And again, this may not be as much of an issue, but we wanted to show you overall what the data was showing. There's a lot more data that we have, and if you look at the report, you'll see that there's a lot of data there. But overall, I just want to sort of leave with a couple of conclusions before we go into what the general plan can do about this. The first is that overall, Thousand Oaks is a very healthy community by many measures. The poverty rates are low. Overall, that it doesn't vary by race, ethnicity. Life expectancy is overall really high. The asthma and diabetes rates are actually lower than the county. There's generally lower levels of pollution. So overall, the city's doing really well, and there's a lot to be proud of, as you know, with the city. But that doesn't mean that there's not areas for improvement. And so what we did see is that Latino Hispanic population has lower educational attainment and lower income than racial and ethnic groups. There are pollution burdens going on in the city, and so there are areas identified as disadvantaged communities, and in particular, some households are experiencing a housing cost burden. And so that leads us to the question of how can the general plan address these inequities? And I just want to sort of pose that there's 3 different ways that the general plan can address this, just very broadly, and this is a little theoretical, but it's procedural, distributional, and structural. So procedural is, think about it as the process. We want to make sure that the process is transparent, fair, and inclusive. As you all have been helping us trying to do that with the general plan update process to reach out to as many people as we can, and particularly people who are not typically part of the process. So we're starting that. We can always do better. COVID sort of threw a wrench in it, our engagement, but we are doing that. The next is a fairly distribute resources, benefits, and burdens across the population. And so we can prioritize resources for communities that experience the greatest inequities and unmet needs. And then the last is structural. And so we can look at sort of the structures or the policies that we have in place and make a commitment to prevent future unintended consequences, to correct past harms, to go and make the community better for everyone. And this is where we can address the structural and institutional systems that are these root causes of social and racial inequities. There are lots of topics that we can deal with when we're thinking about health and equity in the general plan. We went through a series of those, but The pedestrian environment and bicycle transportation are definitely two that we've heard from the very beginning of the process, that, and they are, you know, considered environmental justice issues. Access to parks, to schools, and to health services. Air and water pollution. There are certainly sources of pollution in the city. Food access, educational attainment, and then social service programs that address these underlying causes of crime and address underlying causes of some of the social and environmental and health issues that we're seeing in the city. And so with, you know, now I want to kind of turn it over. First, maybe we can start with questions and then we can move into a discussion. The discussion questions, just to sort of tee this up for you so you can think about it. The first is, given the environment that we're in, given the demonstrations and COVID, have these events and has this time influenced your perspectives regarding equity and public health? If so, how has that happened? The second is, what do you think are some of the most critical health equity and environmental justice issues that Thousand Oaks should deal with? You know, we recognize that there are very broad environmental issues, things that you know, Dr. Freeland talked about going on in North Carolina and in Texas and in other places, but some of those things may not apply to Thousand Oaks. So the question is, what are some of the things that we can deal with in Thousand Oaks? And then overall, what is your vision for a healthy and equitable Thousand Oaks? What are the goals? Are there targets that we want to strive for? Are there measures of success? And then what are specific policies, actions, or funding that's needed to improve health and equity? Okay, so that was a lot. With that, I'm going to stop sharing here. We can come back to that. If folks want to who want to speak, if you can put your camera on, I think it'll be a lot easier for us to see you, and we can see you raise your hand here with this, and we're also going to go to the look at the participants and see who's raising their hand. So you can go and you can do your raise hand on the side, or you can just kind of wave at me. Why don't we start with questions about what Dr. Freeland presented, or questions about the existing conditions information that I presented on. No, I don't see any questions here yet. Anyone? Okay, Rory, I see your hand up.
Yes, one thing that occurred to me is that I haven't heard of any controversy in Thousand Oaks, maybe it's out there, on the issue of gentrification, which is a big deal in other parts of Los Angeles. Is it just because rents are so high anyway, it doesn't really matter? Or do we have redevelopment going on that's pushing out people who have lower rents right now?
Yeah, that's an excellent question. I think you sort of answered your own question there. There are what we, and staff, please jump in here, and Dr. Freeland, but you know, I think what we're seeing is that there's not the disparity that you have in other communities, like in Los Angeles, and there's not the kind of push for new people to move in who are going to bump those people out, and that's what we end up seeing. And so we don't have that disparity in housing in Thousand Oaks. Dr. Freeland, you want to jump in? I see you nodding.
Oh yes, I was nodding and acknowledging that that's true. I agree with you. That's
okay.
Pretty much the way it is, the way I see it.
Yeah, and others can help answer these questions too. GPAC members as well. This is a discussion. So no questions, and we can keep asking. You guys can keep thinking about those. So let me maybe switch and go with maybe an easier topic to talk about, because I know that overall racism and equity is actually a really challenging topic for many of us to talk about. What are the key topics or issues you all think the general plan should address when it comes to environmental justice and the environment that we live in and inequities? Anyone? General plan's not going to write itself, people. Chase, you want to?
Well, if I could ask a question, just to
Sure.
what type of industries are in Thousand Oaks that would generate, say, environmental problems, or are there any?
That's an excellent question. So I think that there's manufacturing that is happening over in the biotech area that could have impact, and I think there's legacy pollution there. There are also lots of smaller auto-related dry cleaners, and then transportation, which are also impacts. And if you sort of see there's a big spine along the freeway, along the 101 freeway, where there is a burden of pollution from the vehicles passing through. But there are also smaller businesses. The city does not, traditionally have heavy industry with lots of trucks. Like if you think about the Port of Los Angeles, Port of Long Beach, so there isn't that kind of heavy industry or heavy vehicles moving through. So again, overall, while there are disadvantaged communities, there's also a lot of there's a lot of good in the city. There's overall, from a health perspective, it's a really healthy place to live. I think we want to keep that in mind when we're doing this. But again, there are other disparities we might want to address. I see Alicia has her hand up.
Okay, hello, hi, this is Alicia. Well, first of all, I'd like to thank you that you mentioned all the social determinants of health. As a nurse, I do believe that that encompasses every person's health. So I'm really happy that you take all of this into consideration. And it is a really great topic. For me, one of the main issues I think we have to consider for this environment justice is we have mentioned housing. For example, the COVID-19 is a great example of why Latinos have been affected the most, because they tend to live, a lot of people in one same house. So that kind of is going to affect, if one person gets infected, more people is going to, all the family is going to be infected. They don't have a lot of people, they don't have benefits, which they cannot work. It's going to affect financial stress. So anyways, one of the things is housing, definitely. Also, the environment as open access. We mentioned last time as transportation. If the area where the people live don't have maybe parks, but maybe if there is transportation available that is close to parks, or maybe Saturdays are free for kids so they can access to a park, or ideas like that. So, but they are all kind of that access. Healthcare. I do work in a community clinic that we try to provide help in that sense, where at least there is some access for the people. But for me, the main issues is always housing and transportation. And but that's the things that come to my mind right now. One of the questions I have is, and one of the graphs, it says the income for Latinos was 83,000.
Yes.
So I don't know I mean, honestly, that doesn't reflect the people a lot of people I know. So maybe that's because these people were not they didn't fill out the census or things like that. But I think that it doesn't reflect what I see in my community.
Okay.
Thank you.
And thank you. Those are great comments. Again, you're tying together these core pieces of what we do in the general plan with housing and transportation and land use with the issues that we're talking about. Just really quickly, in terms of the incomes, that was median household income of a census tract. So there are definitely, in order to have that median, because we know there's a lot of higher income populations, we know that there's a lot of lower income populations as well. And so we can actually get some more data on that. Let's see, Chase, you want to jump in?
Yeah, when it comes to the city of Thousand Oaks dealing with environmental justice, I think you really would have to look at existing infrastructure, especially when it comes to water, because a lot of the disadvantaged neighborhoods, they're older. Their housing is older, the buildings are older. They are the older neighborhoods, and those are neighborhoods where, you tend to have some problems sometimes, and problems you may not realize would crop up, because in the past you did have building standards different, and not all the time that information is not communicated into the future, and there's things we don't know. So as far as, especially with water, that is where we really have to be careful and what we have to look at, because these neighborhoods they're old. I live in one of the neighborhoods on the map that is labeled as having some disadvantages, and that is a concern of mine. Older infrastructure, what's going to happen with that, what's going on, and I think we have to really look at that.
Great, thank you. Tara, you're up, and yeah, go ahead. You're on mute still.
Sorry. Good evening. I just wanted to comment, echoing some of the comments about housing, and obviously people being disproportionately impacted by high cost of housing. And one of the things I noticed, and I know we can't carve the data in every different way. And thinking back to our housing presentation, I can't remember how, if we broke down renters and what the demographics of renters versus homeowners, because Thousand Oaks has a lot of homeowners in the community. And then I just also wanted to, of course, address homelessness, as that is my primary work function, and am passionate about that issue, and just want to raise that homelessness is also an area where we see people of color disproportionately impacted and become homeless, or more at risk of becoming homeless. And often in Ventura County, when we look at our racial disparities around homelessness, we see Black and African American people highly disproportionately represented in that population. And then they end up staying homeless longer, not because they don't have access to services, but because it's harder for them to obtain housing. And so I think that's something that is not unique to Thousand Oaks either, and something that we should be including in the discussion around the general plan.
Thank you. I don't see any other hands up right now, so maybe we can dive into a couple of these topics in a little more detail. Tara, if talking about homelessness and equity, I'm going to put you on the spot here. What's your vision for what a more equitable community would look like when it comes to housing and homelessness? And Alicia, you should jump in here as well, since you commented. Sorry, I'm putting you guys on the spot.
No, that's fine. Thank you. I mean, I think having more housing that is accessible to people at all income levels, that, obviously support the people that work in our community. And so you end up, your community, I feel like Thousand Oaks could be more diverse if there was housing that was accessible for all of the people that work in the community. And then as far as homelessness, one of the things I'm often talking about is access to services within different cities in Ventura County. One of the things that is often being discussed is Thousand Oaks only has a winter warming shelter program and doesn't, so we have people who are on the streets, which obviously we have found through our response to COVID, the longer people are living on the streets, the more risks they have related to their health.
Okay. So some of it is about providing a higher level of services year round.
Yeah, I think that helps then people work on a housing plan and have access to housing resources that may be supported by the city when you have those services.
Okay, great. Alicia, your hand is up. You want to jump in?
Well, a couple of things. Before I forget from the recent comment is that when I know homeless people have access to different shelters or food, different churches. Like I think they do have each church have provides access to them once a week. But an issue is that they don't have transportation. So sometimes for the homeless people, they cannot go from church to church because they're far away. So they don't have access to those services that are out there. But that was just one comment. But I do agree on the access to housing, to have, apartments that are environmentally safe, where there is no cockroaches or, people, some of the people are gonna look for the cheapest places. But then these places they're dirty, or there's a lot of things going on. So access to them, like where they can rent an apartment that is not expensive, but is at the same time clean and healthy environment. So that's one. Maybe having more apartments. I don't know the regulations, but that's one thing. And one of the things I want to take advantage of, make a comment, is I rent a house with roommates, and then I'm talking to other people. They also rent houses. So I'm just thinking, what percentage of the houses like the people own are for rent? Because if a lot of houses are people buy them or own them and then they rent them, that's more like business. And then the people that want to buy, new families or the people that want to buy a home, they can't, because I don't know, it's just an idea that I have. Like, I know a lot of people they buy a house and they rent it. So I don't know what the policies around that, but I think that could be an issue too for new homeowners, if it's kind of closing their access to that too.
So that because people are buying homes and then renting them as a business, it minimizes the opportunity for home ownership for people who want to buy and then live in those houses.
Yes, that's something I came up with the idea, because I hear a lot of people, they rent the house, So like, okay, then who really owns the houses? But yes,
right.
That's the idea.
Yeah, I don't think there's any city policies around stopping that. Very few places have policies like that, but it's certainly something to look into in terms of numbers. I actually have a question for you while you were asking, while you were sort of on the line here. Since you're working in a health clinic, what are the things that you're seeing in terms of health issues that you think might be related to the environment that people are living in? So what are you, because you're pretty close to the lower income populations in the city.
Yeah, I mean, the most common that you have mentioned already is diabetes, high blood pressure. And so again, like Dr. I'm sorry, I forgot his name, sorry, I apologize. That he mentioned that because they don't have access to places to do physical activity, or they don't have the financial means to buy healthy food. So those are the main ones, diabetes, high blood pressure, high cholesterol. And so those are the mains that are,
and it's related to working a lot, not having the money to buy healthy foods, and lack of physical access and time for physical activity.
Yes, that's one example of if both parents are working, and then the children, they just eat whatever is not eating whatever is accessible to them.
Are you seeing high rates of diabetes in children?
Well, we don't see children that much because
Okay.
they have their own doctors. So I cannot say much about that.
Okay.
But definitely the parents, yes, a lot.
Right. Okay. So those are important health issues that relate directly to the built environment that we're talking about. Nicholas Snick.
Yes, sorry, just wanted to quick follow up on a minor point that was made about apartments. I talked to, because I didn't grow up in Thousand Oaks, but I talked to some lower income folks who have grown up in Thousand Oaks, who I know, and that was the topic that they wanted to talk about, was the lack of affordable housing. They were specifically looking for apartments, and I think one of them mentioned that it was to the point where they could identify specific apartment complexes by name because there were so few that they knew all of them and had looked at literally every apartment complex in the entire city looking for places to live because they just weren't that many options. And that led to the decision for a lot of them to actually leave Thousand Oaks because they did not see a place for themselves here.
Okay, and then when you say lack of affordable housing, you mean low cost housing, not deed restricted, right? You just mean housing that people can afford.
Housing people can afford, yes.
Okay.
That they did not have established careers and they didn't see a place for themselves to even live here. The ones that did find other alternatives are still cost burdened, and I have known people who have put off getting access to healthcare as a result of having to spend too much money on rent, and have put off going to hospital for a few days because it might go away. I can't afford it. So.
Okay. I want to come back to that broad comment and the comments that we've sort of been saying about the environment and maybe pose something challenging. But before we do that, Emily, you had your hand up.
Yeah, I wanted to tag on a little bit to the conversation that was happening right before Nick spoke, dealing with diabetes. And although I don't fall into the category of those with, I think anytime people say diabetes, what they mean is type 2 diabetes. I happen to have type 1 diabetes. But I wanted to comment as someone in the, I guess we could call it, world of diabetes, that access to healthy food is, I think, really, really commonly overlooked because most of us in this community are able to just kind of pop into our cars and go get food from places. But I know that for myself and my own personal struggles with health associated with diabetes, food is kind of a constant consideration. It's always on my mind. And if you told me that I had to, maybe I couldn't drive to get the food that I wanted, I would not be able to eat the same. So anyone that's in a low income situation that maybe walks to get their food, which honestly, walking to get my food would probably be better for me in the long run too. My closest options would probably be fast food and gas stations, which isn't great. And then I think of where one of my best friends lives in apartments on TO, and the closest place for them to walk to get food is Whole Foods, and that doesn't necessarily add up either. So I just wanted to put that out there.
Yeah. Well, and I think that's a really good point, and sort of going back to some of the conversations that we've had in the past. This group in particular, the General Plan Advisory Committee, when we did our little interactive exercise about where new uses should go, a lot of you all put kind of neighborhood centers where you could walk and access foods and also places to hang out. So it's sort of a common theme that I'm hearing, and Emily, I think that reflects what you're saying. Are there other comments, or can I be controversial for a minute? I'm going to be controversial. Apologies to the staff. I think I just want to sort of throw this out there. The city has done an amazing job of creating this wonderful place. And one of the things that we've heard throughout a lot of the process is the desire for diversity in the community. And I just want to sort of posit that the way the city has evolved over time has essentially closed the door to a certain segment of the population that could live here. And that there's an opportunity in the general plan to create a wider diversity of housing types, which you all have talked about. But I think what that will also do is change the dynamic about who is living in the city. Because if you have more apartments and more lower cost housing, not necessarily quote unquote affordable, I think what you're going to see is a greater diversity in the city. And I guess I wanted to get the reaction to that, which is that, that has the city in the past, and I don't think it's been intentional necessarily in this, but, have their practices essentially segregated Thousand Oaks from other communities to not have a certain segment of the population in it? And if so, is that something that should change? Oh, I actually do see a hand. Jays, that's great. I was thinking I was going to hear crickets after that comment.
Well, I think to some extent, Thousand Oaks has, the zoning hasn't been very biased because Thousand Oaks was incorporated about the same time when the Civil Rights Act was passed, and,
Good point.
redlining was more frowned upon and all that. So that sort of thing isn't built into the general plan or anything like that. But at the same time, because you have persons of color being, disproportionately low income or disproportionately poor, or just disproportionately, their income is not as high as other groups. I think where the city needs to work on that is to diversify the housing types. It's all about multifamily housing now. That's where you're going to get more diversity, and that's where you're going to get more people housed. And we pretty much know that these big housing tracts that went up in the 60s and 70s, we know that's not going to happen anymore. But diversification of housing is one thing. And the second thing is it mostly comes from people. You have to foster a more welcoming environment for persons of color, because there's a really bad reputation, about places like this. Because I lived in Thousand Oaks for 21 years. And a lot of people, when I say that I live here, people who have never been here, they have a misconception that it's a very racist place. And that's not true. Every place has some biased or racist people, but it's not like this is somewhere like Oildale up in Kern County or somewhere like that. And those misconceptions don't help the city at all. And I do have a problem with that. And I went back to Santa Barbara a couple of years ago. That's where I was born. And, some of my relatives, one of them was surprised to see me. And she was like, "Ooh, I'm surprised to see you here." And she was looking at me kind of funny, it was strange. It was as if I was in this affluent place, and maybe as if I thought I was better than everybody else. I'm not affluent. So I think the misconceptions are built into that too. It's an affluent place. I think misconceptions are big.
So you're saying that you broke up for a second, but you're saying that a lot of the kind of concept of racism, that there's more of a misconception that the area is rather than the fact that it is.
Yeah, I think there is a real misconception. I think the city has to work on that. And that comes a lot with the residents stepping forward. I think we can't rely so much on government to do everything. I mean, as residents, I think a lot of us have to step up and say, well, we have a community. It's not as diverse as other communities, but it's 31%, about 31% non-white right now. So that's moving towards being pretty diverse. But yeah. I think what we really need to do is highlight that we are a pretty fair community for the most part. I mean, like everywhere else, we have problems. And I think in the general plan, I think we really do need to highlight that this city specifically, it just has to be laid out that there's not going to be any unconscious bias when it comes to making policy. We play by the rules. We're fair to everybody. And whether you're a person of color or if you're low income, you have a place here.
So that's a great, I think one of the questions was what's your vision? What's the vision for the city and something to communicate? And I think that's a really good thing to communicate there. All right, Mick, we haven't heard from you yet.
Okay, so yeah, thanks for coming in. I thought in some ways, one of the things that led Thousand Oaks to kind of meet the general plan and get to this point where we are was sort of knowing the history of the sort of the rapid growth of Southern California in general. And so in the 60s and 70s and 80s and 90s and the 2000s, one of the the main dynamic politically is the rate of development and growth within the city too fast. So eventually that governed all the political dynamics within the city over those decades. And probably as a result of that, it led to development and changes in the general plan that led to being a bit more over-indexed with single-family housing and less so with apartments, because the nature of the developments that were coming in for apartments were to be very dense and that sort of stuff. So I think the public in general was a little bit less open and receptive to that, which has now led to the build out of, we're probably a little bit more over-indexed with single-family homes. So I think in general, there's probably an appreciation for looking at the opportunities for where multifamily and apartment complexes could modify that mix a little bit. I think the care we'd want to make sure of is to address those in the changes of where the right places in the city are, and not, for lack of a better term, break what has really been successful in the city of the nature of being able to not develop on the ridge lines and being able to see all the natural beauty around the city. And so I think that that's going to be one of the things that we can do. We can address those items for more affordable housing mixes, yet still honor what's really worked for us over the past 50 years.
Yeah, and again, I think that's another great sort of goal that we've talked about as sort of a frame for the entire plan itself. Of don't fix what ain't broke, and just address the problems and the ideas that you want. Okay, Nick. Oh, Dr. Finley, go ahead.
Oh, I just want to make one comment as well. What you propose as an alternative to your proposal that you introduced this whole conversation with. Say, for example, I know it's difficult to bring this up in economic hard times, but let's just say that the corporations that are here, the high-tech corporations, and I think a lot of this started anyway during the defense industry, during the Cold War, so help develop this whole area. But let's just say some of the corporations are paying the decent salaries so the people who can keep this level of housing high, if they hired more minorities at those high levels of salaries, or even if the people who are hiring people in the area would pay more, then you wouldn't have to think about decreasing the cost of housing, because people make enough money to actually afford these houses.
Mm-hmm. So it's about the income that the employers pay. And we have had lots of conversations about the ability of young professionals being able to come in and live in the city because of the high cost of housing. So I think it cuts both ways there. Especially, as you probably know, at CLU of young professors coming in, and their ability, regardless of race or ethnicity, to be able to come in and actually afford to live in the city.
And we've lost a few. We've lost a few good ones because of it. But if those corporations, had a good minority hiring program, they would certainly diversify the city without, decreasing the level of income you have here, and make that chart look a little better in terms of disparity between the income of the people living in this county based on race and color.
Okay, great. Nick, you had your hand up next.
Yes, I just wanted to follow up on what Chase said about perception. Speaking with other millennials, mostly younger millennials who have grown up around here, there is the perception, I can't speak to how accurate it is, that the housing policy in the city and to a lesser extent at the state level until recently mostly exists to favor people of their parents' generation or older people who bought property here 20 plus years ago at the expense of anyone looking to get new housing now. And then additionally on the racism side, there is the perception among the people I know who went to high school around here that the law enforcement is racist and overly aggressive and hostile to both younger folks and especially younger people of color. So I just wanted to mention that in terms of perception issues.
Yeah, that's interesting. I think one of our future meetings, I think it's in September, if I remember correctly, although Melissa can correct me as she always does with things, that we're going to be talking about community safety more broadly, which relates to the demonstrations. And so I think we definitely want to pick up that thread about perception or feelings of safety, because sometimes the perception is as impactful as the thing itself. Okay, Alicia, you want to speak again?
Yeah, I just want to make another comment like the Chase mentioned is I do believe that Tazonox is very open and in the people that live here. I have never seen any issue or problem, any racist problem against anybody, and I have never heard any bad comment from our population. So I do have to say I have to praise that compared to other cities where I know recent events has put them in the spot. But I do believe it Tazonox is a great city to be in.
That's wonderful. That's great to hear. Thank you for bringing that up. So I want to maybe shift a little bit and think about it just maybe instead of environmental justice, but think a little bit more broadly about a healthy community and what that means. And a small subset of you have been speaking so far, but maybe I'd like to sort of try and get a broader group here to participate. When you think about just broadly a healthy community, regardless of disparities or equity, what do you think about? What should the city's vision of a healthy community be, and how can we achieve that in the general plan? Anyone? And we've talked about housing, we've talked about transportation, we've talked about access to healthy foods. What else? Or do anyone want to kind of dive deeper in any of those? Nick, go ahead.
Yeah,
so I'm gonna start calling on people if you guys aren't talking.
This is why I'm raising my hand. So it seems to me that in any one of these things, so the environmental justice element looks like it's a brand new thing. It's something that the state says it's important for you to take consideration of in the development of your city. And for some of these disadvantaged communities, it seems like access to important elements of living seem to be the biggest things we want to make sure of. So access to information, people should be able to have, maybe, is it free Wi-Fi or some manner of access to broadband so that they're not sitting behind, the rest of the community on their access to electronic information, access to education. Can they get to and from the schools within the community without being overly burdened? Can they get access to, again, healthy foods and access to the other aspects of retail and community, parks, the open space? Can they get to the trail systems if they want to get to the outskirts and be able to take a hike like everyone else can? So identifying those elements of access to important healthy civic living, I think, are the important elements that I can think of, and that seems to be one of the things that would be important to list out in that element. I think one question maybe for you, in my experience, review the general plan in all of its elements usually get kind of focused on a particular project. And so a project may, you know, we need to judge it whether it's consistent with the general plan, but some of these access elements are more sort of public programs that are seen that the city should invest in to ensure these access elements are being, you know, addressed. So from your experience, what are the things that other cities are doing? Or is that a distinction that's, I mean, it's such a new element, so I don't know.
Yeah, so there is, it's a really good question. So, you know, interestingly, this concept of an environmental justice element, the requirement for an environmental justice element is recent. What was happening way before then is healthy communities elements. And so that's why I sort of broadened the question of what is a healthy community, because, you know, ultimately the environmental justice element is trying to make sure that everybody has access to a healthy community. But I think what we really want to think about as well is what is a healthy community and what does that mean? And so there are lots of examples of communities that have created just healthy communities elements, and they address disparities within that, but they deal with topics, and you mentioned a lot of them. A lot of it is access, and there's a combination of physical access of being able to get there, but also financial access to it. And so when you think about like healthcare, it's actually, you know, not just can you walk to a hospital, because when I broke my leg, I didn't want to walk to the hospital, right? I didn't care. I just wanted it to be relatively close. But it's really, do you have access to the health insurance so that you can get the health, as Nick had mentioned. There's healthy foods, walkability and safety, bikeability, living and not putting you know, homes right next to freeways just because of the air pollution. So those are a lot of the topics that have really been addressed. And then of course, communities deal with specific issues that have big environmental justice and environmental health impacts. So, you know, Los Angeles deals with the port because that's a huge environmental issue. Oakland is dealing with the same thing, San Francisco. So there's a lot of issues related to kind of specific topics within that community. Some areas that have a lot of industrial, it's what's the interface between residential and industrial, and Fresno's dealing with that a lot. Again, that's not as much of an issue here. It is in other parts of the county, but it's not as much of an issue here.
And one just quick follow-up, I do know from Dr. Freeland's presentation, he had sort of mentioned about the cumulative effects of certain decisions that get made. And I know, at least from the CEQA analysis, a lot of times when it comes to air pollution and traffic and things like that does get weighed. I do remember that, but there are some of these elements that the environmental justice element would address that are a little bit beyond that are of interest. I know we dealt with that in the past, but this seems a bit broader. So.
Yeah, I mean, CEQA definitely addresses that. And I just want to sort of clarify a point here, which is, you know, I think in sort of preliminary conversations, we're not thinking necessarily there's going to be an environmental justice element, but we're going to take these topics and we're going to spread them out throughout the elements because and think about health and equity as these broad overarching concepts, which you all have talked about either implicitly or explicitly from day one when we've met of doing this. And so they sort of, it's a framing issue here and a framing topic. Victor.
So I would circle back, you know, a little bit on the equity piece. You know, we talk about race and ethnicity, but, you know, I think there has to be in the conversation or people with disabilities. So I know we have the Americans with Disabilities Act, and there's a lot of those pieces that go into construction and, you know, the things that we do. But I think, you know, we can look at that as a minimum standard. Those are minimum things that we should be doing. So I guess the question or the conversation would be, what else can we do to promote that accessibility for those with disabilities to be able to live in our community safely and have an environment where you know, everyone can coexist and has the same level of accessibility to all the great things that we have in the community.
Yeah. And do you have an answer to that question of what else can we do? Before you turn your camera and your microphone off, sorry. You're on mute still.
You know, I think it's a broader discussion. There's a lot of different things. You know, people with disabilities aren't just, you know, it's not one particular disability. There's a lot of different things that I think have to be in the conversation. You know, from how we construct multi-story units to how many we construct on single-story units. So, you know, those numbers I think have an impact. So that's just one thing that I could think of right now. No, we do the curb cuts for wheelchair accessibility and such on the streets, but I don't know. I think it would just involve a deeper conversation as to, you know, are we really doing these things as a minimum? And are we doing them because they're required by law, or are we really doing them for accessibility?
Mm-hmm. Okay. It's a good framing question. I think we can certainly look into that and keep exploring that for the process. All right. Case, you're next.
Yeah, on the point of access, you know, when it comes to accessing healthy food, looking at the map, it did show areas that were disadvantaged, but also I saw some areas that were, you know, labeled disadvantaged that really aren't disadvantaged because of access to a car, you know, car ownership and all of that. And having done some work on the transportation committee and some workshops with Thousand Oaks Transit, one of the things that they take into account is who owns a car or has access to a car, because when you break it down, you know, a lot of that is going to flip the other way. Like you see people living like near the boulevard, adjacent to the boulevard, their access looks better. You have people living way out North Ranch, their access looks really bad. But if you bring in car ownership or car access, that's gonna flip the other way. So that's something that I think we really need to look at.
Okay. Yeah, and the car ownership also relates to the housing cost burden. There's actually a metric on housing and transportation burden, because owning a car is so expensive to do, that it actually, for people on limited income, sometimes you have to make the choice of owning a car and having that access, or having access to healthy foods or after school programs for kids or other things. Okay, other comments? Vision for a healthy community. Dr. Freeland, what is your, what kind of advice could you give, while other people are thinking, what kind of advice could you give this group in terms of things to think about moving forward for health and overall health, and then in particularly equity and environmental justice, that, you know, we as a group should think about for the general plan? You're on mute, sorry.
Thanks. Yeah. I would think about this open space kind of concept. I know there's probably some pressure, you know, maybe build some apartment complexes or more complexes for individuals live in. But I believe that an open space area in just about every neighborhood is probably very important to health, because, you know, you can walk in these areas and there's clean and open air and you start to feel better. If you are stressed, for example, you know, you feel better when you're walking in the park. If the sidewalks are nice, clean, and accessible, those are nice, you know. The neighborhoods are well lit, so that it feels safe for individuals to walk around. I think that's also important for a healthy living environment as well. And outside of, you know, breathing, you know, the clean air, you know, I would say if you build bicycle paths, maybe more people think about riding a bicycle. Well, certainly, you know, we found out during the early stages of this environment, everybody had to stay home, and people weren't driving, how clean air got, you know. All of a sudden, you know, wow. You know, so I think if some kind of way to do that. And then finally, you know, if people just start, those who can afford to, start buying safer things, for instance, you know, go electric or solar, et cetera, and so on. You know, those kind of things sort of help take care of some of the fossil fuels, you know, that cause a lot of problems to people.
Yeah, those are great points. Alicia, you have another comment. Thank you. Go ahead.
Thank you. So my vision is to work as a community. You know, the work community has been in our meetings since the very beginning, and I think we are thankful for that, and we want to continue with that vision. So, for example, to work together as a community, like if one organization provides one thing, and then a different organization provides one thing, and the city supports them. So, you know, it's like a network of supported services. So that's kind of my one of my visions, to have that, keep the idea of community work together. And yes, that's pretty much. Oh, another thing that I had in mind was, again, I'm thankful that you are looking into all the social determinants of health. And as of education, what are the red areas that you have in your map? I recognize that area. There is no open space, for example, right? But again, it's the idea of having access to the bus, or to have all buses transportation. But another thing that I think some of the students, speaking of education, some areas they may not have access to internet because maybe they can afford it. So I don't know, and I know public libraries have free Wi-Fi, but if the student cannot get to the library, then that's another issue. So I don't know how, if the city, or if that could be taken into consideration at one point, you know, providing Wi-Fi, again, talking of equity, you know, to those students. And that's just another idea that came to my mind. Thank you.
Those are great. Yeah, thank you. Any other comments? Some of you haven't spoken. I don't want to call you all out, but does anyone want to contribute anything for tonight that is your vision of a healthy community? Victor, again?
Just to piggyback on the comments we just heard, I think the internet accessibility is really an important factor. We're seeing that with schools being closed, it's really a major challenge for a lot of families to have that internet access. And not just that, if we talk about, you know, as a whole, as a community, I think there are, if we make an effort to be a wired community where there's accessibility throughout the entire city, I think that's something that really we should strive for. Because internet use is now, it's as important as utility as electricity. So I think something that we really have to put on the forefront, where, you know, we're looking at any developments, there has to be some requirements in there to put the accessibility for outdoor Wi-Fi that you know, people can use and enjoy, regardless of level of income or anything else.
Yeah, but you know, it's a great point. I mean, I think I want to sort of tie it back to COVID a little bit, which is that you know, it became obvious the disparities overall about internet and access to internet and how that led to education. And I know that the school district that I'm in essentially stopped education until everyone could have access to internet and technology. And so it just sort of exposed this you know, gaping hole in what we as a society have and what everyone has access to. And so I think that's a really important equity issue. And I think, you know, again, it felt like COVID kind of ripped the Band-Aid off of some of these things. You know, to use a health medical term here, but, you know, rip the Band-Aid off of this and expose this as a real challenge for many communities. Probably less so Thousand Oaks, but many communities across the state.
For sure, I think a lot of people have taken it for granted how easily it was accessible for some people, but now, you know, that the things have changed, and the environment that we're in today is really exposing the challenge that some people have, that other people really take for granted. So whatever we could do in that regard that can enhance the quality of life in the city for everybody, I think is something that we should strive for.
Great point. Okay, Nick?
Yeah, I just wanted to say I appreciate how Dr. Freeland and many of the other speakers for bringing up the cumulative effects of all of these other factors. Because one of the things I find frustrating in many conversations about equity and justice is how much people tend to focus on a single barrier to accessing a service or to good health, and argue that, oh, well, this one barrier by itself is not enough to really bar someone from getting what they need. And I really like hearing people acknowledging that's not just about people who don't have transportation, it's about people who don't have transportation and who have a movement disability. It's about people who don't have access to easy healthy food and who have diabetes, and how all these factors can combine together. And I appreciate all the work you have already done to find areas where there are multiple factors impacting people. And I would just think we need to continue that sort of perspective going forward about looking at how all these things intermesh, and refusing to look at just one item in isolation and saying, we fixed it, it's good. And instead look at where the effects can compound upon each other.
Great, thank you. It's actually probably good, as good a closing as I could have ever done. And so that was wonderful. I think maybe we should take our last time and go to public comment.
Matt.
Yes.
I have one comment from the public submitted through Poll Everywhere. Is now a good time to share?
Yeah, please.
Okay, so regarding questions or comments for the presentation, this person submitted, from the information presented, it seems like traffic and air quality are the main issues that affect our city most. And that's the one comment we've gotten so far. Just a reminder for folks who are watching that you can submit comments after our presentation has ended, and we will get those and take them into consideration when we're doing our notes for the meeting.
Yeah, and I think that is, you know, across the city, it was really traffic and air quality. The city doesn't do as well as other areas in terms of ozone pollution, and so that actually does have an impact in particulate matter in certain parts of the city. There is also kind of across the city impaired water bodies, which is a metric of sort of water quality, where the city overall is not doing well. But I think that the impacts are more specifically felt with the transportation and the air quality. So I think the commenter is spot on with that comment. Okay, public comments. Michael, is this you?
Yes, we do have a few members of the public who have requested to speak this evening. The first one, Edward and Margaret Casaba, but I do not see them on the list. Actually, let me turn on so that people can raise their hands. I see a couple of call-in people. Is Edward and Margaret Casaba one of the call-in people? It doesn't look like it. Okay, we'll go to the next one. And I'm just taking these in the order that people registered. The next speaker, Kurt Sauter. I do not see him on the list either. Rose Witt, who has her hand up. Okay, go ahead, Rose.
Hi, can you hear me?
Yes, we can.
Yes.
Thank you. I would like to point out that as a city within Ventura County, our county's average temperature since pre-industrial times has increased 4.7 degrees Fahrenheit, which ranks as the fastest warming county in the continental United States. That temperature is expected to increase at least 3 to 5 degrees Fahrenheit more in inland areas like Thousand Oaks over the next 20 years, which is within the scope of our general plan. This is important not only from the aspect of increased wildfire risk, which is already substantial in Thousand Oaks, as we've seen over the last 3 or 4 years, but it's also a health and environmental justice issue, because extreme heat is actually identified as the most deadly of natural disasters. And it will only continue to worsen unless our general plan includes ambitious policies to mitigate and build resilience to climate change. I have a few of those that I would like to just mention. One would be an ambitious native tree preservation and planting strategy, which would reduce heat island effects in the community, and also green space enhancement, which would fit in with Dr. Greenland's ideas that all of our neighborhoods should have easy access to green spaces. Another one would be to discourage the use of plastics and styrofoam in our community, given that 90% of those products are now made from oil and gas, which contributes to climate change. And a third one would be to require electrification of new housing, which we're looking at across the city to meet our housing mandates, and prohibit natural gas hookups in those new constructions. That would both reduce our atmospheric emissions as well as significant indoor air pollution that contributes to asthma. And you could provide those kinds of, you could even go so far as to helping some of our low-income communities retrofit their gas hookups for heating and cooking to electricity to reduce both indoor and outdoor emissions. And lastly, I would suggest that we have some climate expertise in our climate plan, both on the community advisory committee and in the plan itself, so that we could come up with ideas beyond the scope of just what I could come up myself. Thank you.
Thank you, Rose. I just want to, before we jump on to go on to the next speaker, we are going to have a meeting. Melissa, you can tell me when it is. Again, I've forgotten whether it's the next meeting or the meeting after that, where we are going to focus on climate change, sustainability, and resilience. And we will address a lot of these ideas and more, because there certainly are more topics that we can address. And our team does actually have a lot of expertise on climate. We've been trying to address some of that through land use and transportation decisions, which is a major impact on climate. But also we're going to be getting into these other topics as well. So I appreciate you bringing that up and tying it to the equity issue as well. Thank you.
Yeah, and just to confirm, it's our September meeting on the 24th that will have parks, open space, and sustainability as the main topic.
Great. So Rose, right in line with what all of your ideas.
Okay, the next speaker is Kyle Springer, but I am not seeing him on our list. Next speaker, Daniel Twett. Also not seeing his name on the list. Next is Silvana Zuka. Sorry, I just muted you again. You should be able to unmute yourself, Silvana.
Okay.
There you go. Sorry about that.
And, as Chase said, to help with inequalities, I think we do need multi-family housing, but affordable multi-family housing. The stuff we're seeing go up right now is not affordable at all. And to address we need to address the low income housing problem, and if we don't make them massive, like the buildings that are going up now, then we won't also impact air quality and have a traffic burden. So we have to be thoughtful in the way that we do build the multifamily housing. So I hear a lot about building multifamily and affordable housing, but it seems like what's happening right now isn't what we need. So I don't know how you can make builders build what is really needed for the city, or if the general plan can address that in any way. So those are my comments.
Thank you.
Thank you. The last person who had requested to speak was Lisa Furch. I do not see her on the list either, so I will ask if there's anyone else attending who wanted to speak, if you would raise your hand and then we can call on you. Not seeing any hands go up. There is still a panelist with their hand up, Victor. I'm not sure if he wanted to say anything further.
Victor didn't take his hand down from before.
Okay. Oh, yeah, sorry.
Okay, no problem. Okay, looks like no one else is raising their hand, so it looks like that's all the public comment that we have this evening.
Okay, I want to just quickly share my screen here, and again, and just show you the upcoming GPAC meetings. On August 20th is safety and resilience. That's going to be addressing important topics that have also come up tonight about fire hazards, earthquake hazards, public safety and policing. So we're gonna dive into that topic on August 20th. September 24th is going to be parks, open space, and sustainability. Again, another topic that came up quite a bit this evening, particularly around access and health. October 22nd is going to be on arts and culture, and diving into the building off of the Civic Arts Plaza and all the other arts and cultural activities that are going on in the city. And then in early December, we're going to circle back to the land use conversation after we've talked about these other topics. And a lot of the other topics, as you are hearing, all relate to sort of land use and transportation alternatives and concepts. And so we're going to sort of pull all of that together as we present alternatives that you all have helped to create. With that, we're at the end of our meeting here. I'm gonna, Dr. Freeland, I just want to thank you for joining us this evening. I thought your perspective was incredibly helpful. We really appreciate your time and your guidance with this, and we may be turning to you again for sage advice on this topic. And I think it's great to know and that there are resources like Dr. Freeland who are living or working in the community who can really help us think through these. So thank you very much for your time. Thank you everyone for participating tonight. I know it was a tough topic. It's a little bit hard to sort of get your head around some of these issues and ideas, but I think that we really did cover a lot of ground, and I think we have a great starting point for developing goals and policies for the general plan, which was the point of what we did, what we wanted to talk about this evening. So again, thank you, and unless there's any further comments, we will see you all in a month, and I'm sure all look forward to the day where we can get back together in a room without face masks and enjoy each other's company. So thank you all. Good night.
Thank you, everyone.